I'm Anthony Pyle. I'm the Carer Gateway team leader. So firstly, I would just like to acknowledge the traditional owners of the land that we are on, the Whadjuk Noongar people, and to pay my respect to their elders, past, present and emerging. So who's heard of the Carer Gateway? Show of hands. Who's accessed the Carer Gateway? Still a good show of hands. It's wonderful that you've heard about it, and we really do love to encourage any carer who is seeking support to give it a go, see what it's all about, and I will sort of unpack today what it looks like practically. Many of you may have attended a Carer Gateway presentation where it's very much this is the idea behind the Carer Gateway. What we're going to look at today is what it looks like to go through a planning session and the actual application of how we support carers through the Carer Gateway programme. So the Carer Gateway, what is it? So Carer Gateway is an Australian government programme providing free services and support for carers. So it was first introduced in 2015 as a website and phone line, and that was a trial. And since then, it has been rolled out fully since April 2020. And it's a range of services that complement the services that Carers WA were already delivering. And Carer Gateway centralises all carer services. Some of you may have remembered in the past that there were sort of many services for carers through many organisations. The Carer Gateway is there to make it easier for carers so that they're able to go one-stop shop for all my caring needs. So the eligibility to the Carer Gateway is Carer Gateway services available to all carers who provide unpaid care and support. The great thing is overseas visitors, permanent residents and others who are non-citizens can still access the gateway. We can't say that of all government services, but that's a really wonderful thing about the Carer Gateway is if you are in a caring role, you're able to access our services. We don't ask questions around, were you an Australian citizen, etc., etc. Carer Gateway isn't means tested. It's not reflected on if you're accessing the NDIS or My Aged Care or any other government service. If you are a carer, you can access our services. So the carers we support. So this is ongoing support for anyone who is supporting a family member or friend, and that's for anyone who has a disability, a medical condition, mental health challenges or drug or alcohol dependency, and those who are frail due to age. So it's a very broad idea of what caring is, and we want to make sure that we're able to support carers in all their caring role and go, if you're caring for someone, you're a carer. It's not about defining what that relationship looks like. It's about supporting the carer. So how do you contact the Carer Gateway? So the Carer Gateway, we're open Monday to Friday, 8 till 5. So if you call us, you'll get through to us and we'll be able to talk to you on the day to start that journey through the Carer Gateway. So our phone number, 1800 422 737. You probably don't need to write it down. I'm hoping it's printed all over our lovely materials today, and you'll probably have a couple flyers. But you can also, if you don't get through on the phone, you can request a call back on our website. So we'll get an email. We'll be able to call you back at a convenient time for you. You can also visit the Carer Gateway website for a little bit more information about what our services may look like. Oh, sorry. Let's go back for a second. There you go, if anyone needs to write anything down. So the Carer Gateway model, what is the model based on? So it's a person-centered approach to understand the carer journey and impact. It's dissimilar to some other government services where it's like you're assessed to a level, similar to My Aged Care where there are 4 levels of care. The Carer Gateway is about providing support individual to the carer in that moment. So it's about understanding that individual carer and putting in a plan that suits their needs. So it's focused on early intervention, preventative and skills building supports as well. So we want to make sure that when we're talking to a carer, when we're working with a carer, we're going, how do we make your caring role sustainable? How do we provide support now to get you through this challenging period of caring? Or how do we build on your caring role so you're able to manage this long into the future and that you don't feel that carer stress or burnout? So it's designed, yet again, I've run ahead of myself, designed to build resilience and improve health and well-being. So the planning and the carer star. So this is the big portion of what we do. When you first call us, you'll go through an intake conversation. So this will be just to grab a little bit of information about what your caring role is, what you're potentially looking for when you call Carers WA and the Carer Gateway. And from there, we can book you into a planning session. We may provide you information at that moment. It may be that planning session isn't the most appropriate thing for you to go through. So it's about unpacking in that first interaction with the carer, with yourselves, what that is that you require in that very moment. Like I said, person-centered. So yet again, exploring how the caring role impacts on your life. So that will be, if you go to a planning session, we'll really start to dig a little bit deeper about your story, your caring role, and your experience. So it's a reminder that anyone going through the carer star, it's a collaborative conversation between the carer and the planner, that at times the planner may challenge you. They may go, well, how do you feel about this? Is this something you've explored? Because at the end of the day, we're working together to find out what skills we can build, to recognise your contribution as well, and to go, we're going to move forward together and support each other to get the best outcome for the carer. It's also a strength-based approach. So we don't look at going, how challenging is your caring role? It is part of the conversation, but it's about recognising how strong and resilient all of you in this room are, to recognise that there's some things that you do so well, and we want to continue to support you to do those things really well in your caring role. And ultimately, where the carer is looking for help, you've rung up the carer gateway to receive some level of support. You are going to be the experts in your own life. You're going to be able to provide that support to us to go, this is where I'm really struggling. Here's what I think will actually be really, really helpful for me. And we'll listen and we'll explore what we can do through the program to meet those needs. And planning for the future. At the end of the day, some people may be in their caring role for a very, very, very long time. Some people may be in their caring role for a very short time. But at the end of the day, all caring requires some level of future planning, and we want to be able to be there to provide supports, information, whatever it is we can to make your caring role more sustainable and to make sure that you don't experience carer burnout. So there are some... Sorry, have a quick drink of water. So when we're looking at the carer star, and for those who've gone through the carer star, you'll know that we go through the caring role. So we want to explore what that looks like when we're discussing that discussion. So the caring role may look like you provide personal care for the loved one you're caring for. It may be that you cook meals or mealtime management. Medication management is also a part of the caring role. Attending appointments and sorting reports. These are all aspects of the caring role that you may have to do for your loved one. Emotional support and assisting with finances. So these are all areas we want to unpack with you to say, are you doing these things for your loved one? Is that something you find is a strain on the relationship? Is that something we can find solutions to support you in? So a quick case scenario for this one. It's sometimes easier to go through case scenarios than me just give a bunch of dot points. So this is Jasmine. So Jasmine cares for her mother, who is frail-aged. The caring role is new to her, and she's exploring what this means for her. And she's really just unsure of what services are available. So she needs to ask someone, what can I access? And the caring role has, unfortunately, impacted her employment. So when we look at that through the Carer Gateway supports and the Carer Gateway model, so we have a referral to our in-person peer support to learn from other carers. So this is a really wonderful opportunity for carers to meet other carers and go, what worked for you? Where can I, go? And I think peer learning is a really key thing for carers. They don't want to necessarily hear from someone who doesn't have their lived experience, but we can bring carers together, we can facilitate, and we can make sure that they're talking with one another to get the best out of their caring role and learn from other carers. So a referral to the Carers and Employment Program for carers who've fallen out of employment or are looking for new opportunities. That is another support and service that Carers WA can provide for carers. And information to My Aged Care and other government services. So making sure that Jasmine's mother is actually receiving the services that she's entitled to, that she's not providing care where there could be some funded supports in place that will help her maintain that caring role for a long time. So the carer's health is another area that we want to look into. We want to make sure that carers are healthy and that they're maintaining wellness so they're able to continue their caring role. So the carer's physical and mental health is really key. We want to understand where they're at mentally, physically, that they're not missing out on doctor's appointments, that they are looking after themselves so they can look after the person that they are supporting. So, yet again, I'm getting ahead of myself. Carers' time to attend their own medical appointments, an ability to undertake healthy eating and exercise. Many carers express that they don't have time for themselves. Oh, I'm getting a bit unhealthy. I've not been able to go for a walk. I've not been able to go to the gym. Recognizing that these are things that carers are entitled to go and have some time for themselves to maintain physical health, and to go when that's not happening, we have to recognize that that is a real impact on the caring role. So managing at home is another area that we like to explore with our carers. So exploring aspects of managing the family home. So there's a lot of different areas that this may be impacting. We have to recognise that while we all look after our own homes, that when we're also a carer, there are aspects where we are doing 100% of the chores around the house, and we have to recognise when that is impacted by our caring role. So keeping the house clean and tidy. So I like to give a case example for this one, that this is really individual to every single person, that someone may have the most immaculate, beautiful house, and a spot of dust on the kitchen counter goes to show that their life's falling apart. So we have to recognise that when someone says, oh, I usually don't have any dishes and there's 2 on the side at the moment, which means things are really bad. And if you come to my house, there's 20 dishes and things are fine. So we have to recognise that everyone's a little bit different in that area, but we really do like to go, well, what is the normal for you? What is the norm where you're looking to go, well, actually, I haven't mopped my floors in 4 weeks, and before I was in a caring role, I made sure I kept a very tidy house. So we're recognising there that that caring role is having this huge impact on the carer. Maintaining the garden is another one. If the garden is starting to slip and you're going, well, actually, I used to have beautiful rose bushes that are now tangled and overgrown. It's one of these things that we have to recognise that not managing at home has this huge impact on the carer's mental health, especially if they're very house proud, especially if, I think good mental health comes from a tidy home, but we have to really, really recognise that these things may seem small to outsiders, but to the carer, they're a huge impact on their own mental health and well-being. Time to prepare meals at home is another one. If you've gone from being a person who cooks fresh meals with fresh veggies and fresh meat to someone who's using microwave meals all the time, that is a huge shift that's potentially been impacted by your caring role. And we have to yet again go, is this the norm for you? Is this something that you want to get back to? How are you going to find time to make freshly prepared meals and go back to your norm before your caring role, or to at least try and go back to it? So a quick case scenario for this one. So we have Catherine. So Catherine is caring for her husband who has dementia. So the gardening slowly becoming unmanageable along with the caring role. And both of them are on the pension and they are unable to afford a gardener. So the Carer Gateway supports that we'd look to put in here would be we'd provide information around the carer's payment or allowance. There's a lot of carers who are unaware that they have those entitlements, and we really do want to encourage people to get those sustainable long-term financial supports in place, especially if at the moment they're managing. It's just a tidy bit of money they can pop away for a rainy day and go, oh, actually, if we're just putting that away every week, maybe we can pay for our own gardener down the line. So we make sure that everyone has access to carer's payment or allowance. We'd provide a referral to the ACAT team, so the Aged Care Assessment team, to make sure that not only Catherine and her husband have their own ACATs done. We've got to remember that carers over 65 are also entitled to those supports and services, and we want to make sure that everyone is getting their entitled supports. Carer coaching. So carer coaching is another service that we offer at Carers WA through the Carer Gateway. So carer coaching is really about having that conversation with one of our coaches and going, I'm not really sure what I could be doing. These are my goals, but I don't know how to get there. And with the coach, the carer focuses on their own strengths to be able to find the way forward in their caring role and to come up with their own solutions and goals and aims that they're able to then get to where they're aiming to go. It's not about us telling people how they're going to do it. It's about supporting carers to come up with their own solutions and be able to find their own pathway forward. A referral to financial counselling as well, recognising that paying for any services in the home does cost money. We've got to be prepared for it, and if we can provide a financial counsellor or we can link someone in, that's really worthwhile. Most people haven't ever spoken to a financial counsellor. Most people don't recognise the service is free, so we just want to be able to provide that information, make that soft referral and go, well, maybe this is all achievable, but just have a quick chat with someone about where your finances are at the moment. And an action plan to set practical strategies. So everyone who's gone through the Carer Gateway will get an action plan, and it may be that it includes a step-by-step process about how you'll be able to access these supports going forward, and also what we're putting back to the carer to go, do you feel comfortable going and doing this? Okay, no worries, we'll come back, we'll figure out what your capacity is at that moment, so we're able to support you and build on the things that you're able to go and achieve for the moment with the support of Carer Gateway. So time for yourself is a really, really important part that people sometimes don't value as much as they should, but it's really important to see, how often is the carer seeing their family and friends outside of the caring role? We don't want carers to be isolated. It's really, really key that we're making sure that people are connected. What are the hobbies of you guys and the connections with your community? We want to make sure that you're going out, that you're having normal, ordinary friendships and community participation. We want to make sure that people feel connected. We don't want carers to be like, I stay at home with the person I care for and I don't, ever get out and about. That's not great for any carer's health, and we really want to see how we can change that. So time as well to rest and relax. We need to know that the carer has time away from their caring role, that they're able to put their feet up, have a cup of tea and put on their favourite Netflix show. Or whatever your broadcasting preference is. ABC, 7, etc. So how the carer feels, this is really important yet again. It's really an extension of the health aspect, but really focusing on mental health and how we go forward. So well-being is always important. People may not consider that they have a mental health condition. There's definitely a lot of evidence to say a lot of carers experience poor mental health, depression, and it's really, really key to go, are you seeking support for that? And that will be an action that many people may see within their action plan is, definitely go speak to your GP, maybe join a carers group so you're able to discuss these things that maybe you keep to yourself rather than letting it eat away at you as you're going through your caring role. So your overall impact on mental health, yet again, is really key, just to make sure that we recognise that the caring role does take a toll on everyone's mental health and that it's okay to talk about it and to make sure that you're reaching out to the right levels of support. Impacts on relationships, yet again, when we were talking about previously, connections to friendships, connections to your family, making sure that those relationships stay strong. These are all really key things we want to unpack, and we want to be able to go, well, how is it going talking to those family members? Because they may go, yeah, I've got lots of friends, but the relationships have really broken down because they don't understand my caring role. And we need to make sure that we go, okay, well, that's definitely an area that you're really, really struggling in. And does the carer have someone to speak with when they're overwhelmed? It's great to have lots of friends, but when you're not able to actually speak to anyone about that caring role, it feels like you've got no friends at all. So we really want to make sure that we're actually asking the question, do you as a carer have someone that you can confide in? It's probably another carer realistically, because that's that lived experience that people share and understand. But ultimately, it's about the carer being able to go, yes, I have someone. When things go really bad for me or I'm really struggling, there is someone on the end of the phone that I can talk to. It may be a professional, but hopefully it is a friend as well, to make sure that people are really well connected and supported. And making sure that those existing support networks are there, that we want to make sure that there is someone who you can go to, that maybe there's someone who can also provide care to the, an alternate carer. So it's not just all on the individual carer to go, it's just me and the person I care for in the world. We want to make sure that people are connected, that they have lots of other support networks, and that they have someone to go to. So a quick case scenario for this one again. So we have David. So David cares for his daughter who has recently been diagnosed with a disability. So he feels really overwhelmed by the caring role and disconnected from his peers. His peers, they don't know anything about disability. He works a full-time job where none of it, his peers do have kids, but they don't have kids with disabilities. And it's just made him feel really, really disconnected. And he also feels like he doesn't know anything about disability. Some carers, their first experience with parenthood may also be their first experience with disability. So double overwhelming, and they want someone to talk to about all these things. So it's very, very difficult when there is that additional thing put in there that they're really struggling with. So the Carer Gateway supports in this area would be a referral to counselling to discuss the caring role, linking David in with some parent carer support groups. There's some really wonderful ones out there where they can, even to the point where there's an autism dads network. We're getting really specific that there are many carer groups out there that really meet the needs of individual people, and we make sure that people know about them because, like I said, when there's lots of them out there, we sort of miss a couple when we're looking for them. If we do a quick Google, we go, oh, there's 400. Which one am I going to? So, and then information about disability, the NDIS and other disability services. It's really important to recognise that the NDIS isn't everything. It's a big portion of those supports, but to make sure people know about the peer groups, that they know about in-home childcare for kids with disabilities. There are many things that people can access that we really like to share and let people know about because it means they're more supported than that one government system. And then a referral to in-person support, as we've mentioned earlier. If David can get around people who are his peers, who have similar experiences, he won't feel as alone. He'll be able to get some ideas from parents who've gone through this before and, figure out what he's going to do next with the support of Carer Gateway. So we do look into, the area is called the carer's finances, but it's not about looking necessarily at finances. It's about looking at what the carer can access to alleviate some financial stressors. So yet again, the carer's payment and carer's allowance is the big one that we go to make sure that the carer is accessing entitlements that they're allowed to get. The disability support pension is another big one that we want to make sure that the care recipient is getting, or potentially the carer if they're entitled to it as well. We want to make sure that all the entitlements available are being accessed, as well as concession programs. That could be, Transperth cards, that can be there's energy subsidy bills, all things like this that exist out there for people in the caring role. And, if you go on the Department of Communities website, it's a huge list that most people aren't really aware of. So we really want to make sure that when we're listening to a carer and they go, oh, my power bill's really high because I have this disability specific equipment, we go, did you know about this? Did you know you can get, money off your power bill in this situation? Because every dollar counts, every dollar makes a difference, and we want to make sure that people don't just think there's one service that will support them and then they have to manage the other stuff on their own. There are many concession programs, and we want to make sure the carer's finances are as strong as they can be so they're able to maintain ordinary life as well as their caring role. And, exploring the ability to cover costs related to the caring role. There will be additional costs related to the caring role that none of us expected. We want to make sure that we're able to provide that support going forward so that carers are able to go, oh, I know there'll be an expense coming up. I really want to plan for that. I want to be ahead of it so I don't have to worry into the future. I know that there's a respite cost coming up, or there's a bit of equipment that I may need in the future. And with the help of financial counselling, with carer coaching, I know I'm going to be on top of that, and it's never going to be a surprise when that time comes. So another quick case scenario about Keith, who's struggling with his finances. So Keith is looking at respite for his wife, who he cares for. They're both on the pension, and he's concerned about the cost of ongoing respite. So when we look at Carer Gateway supports, we would look at providing information about carer's payment and allowance. Yet again, it's a really wonderful thing. That's why it's through the presentation. Referral to financial counselling to make sure he can have a discussion with someone who is trained to be able to discuss how we manage our finances. Also a little bit of information about the My Aged Care Financial Hardship Assistance Programme. It's definitely buried away on the My Aged Care website, and we need to make sure that people know that if they really are financially strained, that they can call My Aged Care, they can talk to a professional there and go, well, what is your responsibility to us as a family to navigate the rising costs of respite, and they'll support you through that as well. And the referral to carer coaching for future planning. Yet again, if that's the concern is what's going to happen in the future, we want to make sure that we can give some strategies in place where the carer is then able to navigate this into the future. And hopefully when those rising costs or the ongoing costs of respite come around, the carer's already figured it out. They know how they're going to manage that situation. So we do touch on work as well, what the carer's working situation is like. So exploring how the carer's role impacts your employment and the hours you work. So it's not just a matter of are you working or aren't you working? It's about saying, do you work full time? Do you work part time? Is there times where you have to go home due to your caring role? Is your employer understanding that your caring role will impact your work? Are they supportive of this situation? It's really, really important that we unpack work fully, because a carer just saying, I work full time, that's like, oh, wonderful. And they don't unpack the idea. They go, well, actually, I have to go pick up my son from school regularly, and it really is impacting, and my boss is really unhappy with me about that. So we need to really, really dig deep and go, what does work look like for you? Where does it impact you in your caring role? And reflecting yet again, if you're retired, volunteering, or your time spent caring. Some people go, I'm retired, it's amazing, except I'm caring 30 hours a week, which yet again is another full-time role. You can be retired and caring so much that you're probably doing more hours than someone in a full-time office job. So it's really good to recognise that the caring role within itself is its own job. And how we can support you in ongoing employment for those people who are still going through employment, who are unemployed, who are looking for a new job change. We want to look at what that looks like, and we have a list of carer-friendly employers as well when we're looking at supporting carers to go, these people are really wonderful to work for. They really understand the caring role. So that was an overview of the Carer Star and the aspects that we discussed through the Carer Star. Overall, the aims and goals, so this would be where the action plan comes in, is what once we have that information, we look to deliver back to you, the carer, and to be able to say, this is what we want you to look at and see if you think this is achievable. So the connection to Carer Gateway services, so the coaching, the IPPS, the in-person peer support, counselling, it's all about going, what are the Carer Gateway programs you can access today or down the line if we make a referral that you're able to go, that would work really well for me. As well as referral to Carers WA programs. Carers WA has a range of wonderful programs that people can access and really explore complementary services to the Carer Gateway services. So advisory supports to external services as well, recognising that the Carer Gateway and Carers WA isn't the only thing that will support carers. We can really link you in with information, forms, information sheets, etc., to make sure that carers are able to go, actually, I need information about my aged care, the NDIS, Centrelink subsidies, Centrelink payments. We want to be able to provide that information in a way that is accessible and approachable for carers who are incredibly time poor. And yet again, just that provision of resources. There's so many wonderful resources out there for all experiences in the community services sector, and we want to make sure we're collating that so that you as the carers don't have to go out and seek this information. We can listen to your story and go, this is what we think would be helpful to you. Did you know about this resource? So just a quick rundown of the Carer Gateway services. I have talked about a few of them as we've been going through, but the in-person peer support is where peers get together and they have a discussion and they have a morning tea and an hour together where they learn new skills, they share their knowledge from being carers, and it's a way for carers to empower themselves amongst other carers. We also have the facilitated carer coaching, which I've mentioned, where carers are able to set some goals and work through that with a coach. The counselling service, so the counselling is available face-to-face, or there's also the carer counselling service over the phone that can be accessed. Phone counselling yet again. We've got skills courses on the Carer Gateway website. There's a plethora of skills courses that people can access and decide to take under their own study time. If they're a bit time poor, they can go to the website and take on those whenever they've got time. Social Support Forum is also a service that is available on the Carer Gateway website where people can discuss things on an online forum to be able to access supports from other carers anywhere in the country. And then tailored support packages for carers who require a little bit of support to get through a period of caring where they're really struggling. So we tie that in with the other services to make sure the carer has some breathing room to be able to move forward in their caring role. And emergency respite as well, for when there's a situation that happens that we don't expect, that we're able to provide support in those emergency situations, and that we can talk to the carer about, what is happening right now. If you're unable to care or provide care at this very moment, let's see how Carers WA and Carer Gateway can support you. We also have a range of modified and accessible services. So Carer Gateway is growing and growing in the way that we can deliver services. And it's really important that we recognise that not one size fits all. And we want to make sure that those services meet the needs of the community. So we've just started, we have mobile planners, so planners who can come and meet with carers in their home or within the community to be able to provide that support where over the phone isn't necessarily going to work. We also have video conferencing planning, where we're able to provide planning over Teams or Zoom or WebEx or whichever service we're using at the time. But it's really to provide that ability to go, well, actually, I'd really benefit seeing the person's face. I don't necessarily need you to come meet me in the community, but I find over the phone doesn't work very well. So we want to be flexible with how we deliver those services. We also have culturally appropriate and complex pre-planning conversations. So we want to recognise that not all communities are the same and that we try and explore what the cultural aspects of that would be. And we listen to the carer and go, what is it that you need within your culture to make this go smoothly? We also have individual advocacy for those caring situations that require someone with a bit of skills and know-how, to knock down the doors of other government agencies. We also have our specialist champion organisations. There's quite a few here, so I'll have to read this. Palliative Care, Chunghwa, MPW Women's Council, Goldfields Women's Health Care Centre, Umbrella, and Helping Minds, who are our regional partner. So it's about having specialist people deliver the carer star who are able to recognise that they understand their community best and they are able to do the planning with that culturally appropriate lens. We also have our Aboriginal engagement team who work with Aboriginal people who are very interested in talking to an Aboriginal person to respect the cultural aspects of the planning session. We also have our young carer team who work with anyone from 8 to 25. So that's for young carers. And the services there are a little bit different, but it's really about having a youth team who are able to navigate that space with their expertise knowledge. And we also have interpreter services and a relay service for those who are deaf or hard of hearing. So that's the presentation, and I know I'm running low on time, so I think questions, yeah? Wonderful.
We can have the mics ready.
Oh, sorry.
We'll just grab the mics, and then for those online, they can hear the question as well.
I will take a quick drink of water though, because very dehydrated. And can I just say quickly, if we do run out of time, I do want to keep the program running. I am going to go stand by the desk at the far side and I'll take questions there as well. So please don't feel that you're going to have your question missed. It's just we have 7 minutes, so I will go talk to you all out there as well. Sorry, go ahead.
Hi, my name's Pip. Thanks for your presentation. And I appreciate that Carer Gateway is a great starting point or springboard for assistance. How do you follow up with people after you've got a carer star and a plan that you've agreed to? There are dates on it. Yes, we'll connect you with this service, that service.
Mm-hmm.
Does Carer Gateway recognise that not all carers have the capacity to then act on those suggestions? And how do you follow up with clients?
Oh, sorry. I'm sorry to cut you off there. Absolutely. And I think that's about recognising when we have that carer star conversation is to say, where is the capacity? 5 minutes, was it? The carer's capacity is all about going, well, what do you think is achievable right now? At the end of the day, when we send the action plan to the carer, we do ask them to go, is this appropriate? Are you able to do this? And we make sure that if the carer is in a heightened period of caring where they are struggling, that we don't overload them. We don't want to go, well, you'd benefit from these 40 resources knowing that they don't have capacity to ring 2. We need to make sure that that is really receptive. And, I'm very proud of the work we do to make sure it's person-centred and that we are really looking at each individual case and it's not copy-paste. It's this is good for this carer. Does that answer your question? No? Oh, sorry? Yes, absolutely. Yeah, absolutely. So we do send that information on to carers and we do have a review process as well where we touch base with the carer and go, how did it go? Even if it didn't go well, we go, okay, well, let's revisit this.
Hi, my name's Nancy.
Sorry. Oh, hi, sorry.
Hi. I work in old adult mental health as a carer support coordinator and just wondering how accessible emergency respite is at the moment.
So emergency respite is very specific around a carer being unable to care. It's actionable within 72 business hours. So a carer does need to ring up and we need to figure out what is going on, and it is actionable. Sorry, I need to have another drink of water. Yeah, it's actionable within 72 business hours. So if you called on Friday, it would be started back up again on the Monday. But yeah, it's fully accessible to those who need it and meet the criteria.
Hi, sorry, can I just jump in?
Sorry, but I think this lady was waiting. Was that?
You go.
Sorry.
Hi, I'm Rebecca from Helping Minds. I meet with a lot of people who feel unheard during the carer star process or don't agree with the outcome.
Okay.
Is there any way that they can challenge that?
Absolutely. Absolutely. It's worth having that conversation with us and going, I'm not sure I am there in my carer star, and we can have that conversation and really unpack that. Ultimately, like I said earlier in the presentation, it's a collaborative approach. We want to make sure that both sides do come to that agreement and go, well, this is the support plan that works for me. There's no point us as the Carer Gateway dictating what's best for the carer. That doesn't work. It's not in the nature of the program. So I would really always encourage a carer to come back and talk to us about it and go, it just didn't gel with me. I'm like, okay, well, that's fine. Let's really have that conversation again then. Let's see, what it is that your action plan requires, what we've missed in your caring role that, didn't quite gel. So absolutely, it's not you're one and done. You can come back and have that conversation.
And what time frame would that involve? Like, when can they come back and reapply if they've received no support?
Well, it's not really about reapplying. It's about being able to have that conversation again. Like, there's not a time frame where a carer wants to have their conversation about their caring role again. They're able to go, well, something's changed in my caring role. We could have the conversation today and tomorrow something changes. We don't want to be so prescriptive as to say, well, they can't call us back for however many months. The caring role within itself is fluid, and we have to recognise and respect that. So if there's something not gelling with them within their action plan, it's worth having a discussion, but it's also about recognising that an action plan isn't always just tailored support. It's linkaging to counselling. It's asking the carer to take on a task that will help benefit their caring role and to reflect on that when the carer has been able to access a range of other services. I think we have time for maybe 2 more questions, and then like I said, I will be outside and I will talk to more people.
Hi, my name's Teresa.
Hi.
I wondered, I know that you help with Centrelink. Do you help set up MyGov and all that goes with that?
Unfortunately not. I mean, it probably really is an information referral service. We do try, Centrelink now take appointments, so we make sure that people are fully across that we make sure that changes in other government services are known about so that people can navigate.
It's something that in my role at my work I help with.
Oh,
and
wonderful.
It's really overwhelming for the parents to gather the information and then have the authorization for the child with a disability who's non-verbal or has intellectual disability to have the authority to get all that for the kids. It's insane and it's really frustrating and
No,
it's
I absolutely hear you. And I guess that's one of the wonderful things about Carers WA. I know I'm speaking about the Carer Gateway, but we do have a systemic policy officer as well at Carers WA. So those things are systemic barriers and we'd love to hear about them. We'd love to navigate that better because they are these big problems that many carers are facing. So I do have time for one more question. And then, like I said, I'll be outside. I'll take more questions.
Good morning.
Morning.
My name is Angela. I'm from Cal background. What happened during the pandemic is my daughter-in-law come here. She got stuck. She cannot go back. In between this, she got 2 kids, okay? One was previously born and one was born here. But during that time, I cannot ask any help. On your chart just now, you said carers are for medical condition, disability, and aged care. What about grandmothers?
So
Looking after grandkids?
absolutely. So I do recognise that there is a caring role there. Unfortunately, it doesn't meet sort of our requirements for support. There is a grandparents rearing grandchildren organisation, which I think that's what it's called, but I've spaced. Does anyone know it? Yeah, through Wansley. Wonderful. So there is a separate program that supports people in your particular situation. But yeah, unfortunately, those are the sort of the criteria that someone has to have a disability, a mental health condition, a physical health condition. But like I said, we're not the only organisation out there, and there's some wonderful organisations that would be able to support you in your particular situation. And we'd be more than happy to link you in as well if you're unable to find that information. We can definitely do that. Okay. Yeah, it would be the social support group. Sorry, I was talking specifically about Carer Gateway. Sorry about that. I should have been clearer. But no, thank you. No, we do have social support groups, though, that are there for people who are in those caring roles, and they're able to talk to other carers. But for those more practical supports, like I think maybe you were asking about, that there is grandparents rearing grandchildren is my memory of. Someone's nodding, so I think that's the name of the organisation. But sorry, I've run over time, but realistically, I will go stand out there and talk to you for as long as I need to. But thank you so much, everyone, for listening and being involved.